Hi guys, Dr. Welsh here from Indy Sport and Spine. I just wanted to talk to you a little bit today. We're going to follow up a little bit to last week's video where we talked about carpal tunnel syndrome. We discussed a little bit about what it is and more importantly what it's not. So today we're going to follow up with that to give you a little more information on how you can treat this and not only prevent it but also help alleviate the symptoms if you are experiencing pain in your hand, wrist, and even your forearm. Pain, numbness, tingling, that sort of thing. Okay, so we're going to take you through a few things. These aren't by any means a complete overview of all treatment methods and options for you, but it will give you a way to start off, somewhere to begin, and not only trying to take care of this stuff, but preventing it going down the road. So, as we go forward through this, like I said, it's not a panacea for all arm pain. If this doesn't work, if the stretching that we take you through is not doing what it should, or giving you relief, then by all means, have a professional check it out. Go see a chiropractor, physical therapist, somebody that's going to help you with some conservative management with these problems. Okay? All right, so I'm going to take you through a stretch here that you can do throughout the day. And this is one you want to find a table, a bench, something that's a little lower than what you have to reach down for. So you want to get your arms straight. And what we're going to start off with is just extend your hands backwards, press down into them, and kind of dig around in that. You can move side to side, and you're just going to feel through that, see where you're feeling those restrictions, where you're feeling the tension. Okay? A lot of these, you're going to find some tight spots through your forearm, whether it's in the front or the back side. Some of them you may not feel much at all. But the idea is that you dig through this, and then you try to find the areas that are giving you the most trouble. Whether you have an active job, manual labor job, or you're doing, you have a computer job where you're at a desk a lot, you're going to develop considerable amount of restriction and tight muscles through the forearms especially that can lead to issues through the wrist and the hand. Okay, so again, start in extension. You can work your way back, open those up a little bit. You can go out, you can go in, and then as you work your way through those, then you're going to put your wrist the other way. Push them down, lean back into it. And some of you may not be able to go this far, okay? Some of you may be able to go farther. But you're starting where you're going to start, okay? And you just keep working this. When you're in this position, if you want to try making a fist, you're going to get an even better stretch, okay? And like I said, you may not be able to get your hands flat on the surface, and that's okay. But it's a starting point, and that's where you're going to start to work. So if you can stay consistent with those stretches that we just went through, do them several times a day, okay, you're going to notice some pretty good range mobility improvements in your forearms and your wrists, and hopefully along with that you'll see the accompanying effects of decreased pain and some improvements in your other symptoms as well in your wrist and your hand. Okay, and like we stressed earlier on, this is not a fix-all for all things in your arm and your hand. If these don't do the job, if this doesn't seem to alleviate a lot of your problems, or if it just doesn't seem to be doing it as quickly as you'd like to see, and that should be, this should take several days to even a couple of weeks to start seeing some benefit. Definitely check it out. Check with a professional, whether it's a chiropractor, PT, massage therapist. You want to find somebody that's been trained and that handles this stuff on a daily basis that can understand and help you through what you're dealing with for your specific case. Okay. There's several other things that we can do in the office setting. Particularly with me, I use Graston therapy. I can use ART, different soft tissue techniques. Cold lasers are very effective at decreasing the inflammation. And there's some issues as well with carpal adjusting, or adjusting the bones in the wrist, making sure everything's moving as it should. So I hope this gives you a good overview of what you're dealing with, how to start treating it, kind of get your foot in the door of how to take care of these things on your own. And like we talked about again, if it doesn't help, if it doesn't seem to be working, don't despair, don't jump straight to a surgical process just because you don't know what else to do. Check with a professional, look for some conservative treatment methods, and try to find out what exactly is going on in your particular case. All right, again, if you have any questions, feel free, write it down below in the comment section. And like and subscribe us. Definitely share this out there to any friends you know that might be battling these same issues. All right. So for now, I'm going to sign off. Again, this is Dr. Welsh with Indy Sport and Spine, and have a great